Tonight I am talking about 5 things to know about weight loss medications. 5 things that you should know about weight loss medications. I am so excited to talk to you guys about this because y'all, I feel like I'm spilling the tea or something because I get so many questions about weight loss medications in my email, in my DMs, and I feel like I answer some of the same things back to back to back. So I thought it would be a great night to come on and talk a little bit about weight loss medications. And we'll just start out for tonight with 5 things to know about weight loss medications. As always, if you are joining, drop in the chat. Where are you joining from? I am joining live from Las Vegas. If you're new here, I am Dr. Jade. I'm a board-certified family medicine physician. I practice medicine with an emphasis on prevention and lifestyle medicine. A niche of mine within primary care, or a specialty within primary care, is weight loss. I help my patients transition to and maintain a healthy weight, which in the long run helps to decrease their chronic disease burden, thus serving them with the best type of primary care. If you're in the Las Vegas area, look no further for the best primary care experience and the place to help you transition to a healthy weight. That is at Inspire Primary Care. We are now accepting both primary care members and medical weight loss members to our practice. Okay, so here we go. I see some Las Vegas in the comments. Where are you guys joining from? Let me know. I'm coming live from Las Vegas from Inspire Primary Care, of course. All right, so tip number 1, let's just jump right into it, okay? The first thing I want you guys to know is weight loss medications are a tool that can help you get towards success, okay, on your weight loss journey or towards your weight loss goals. What's up, Vegas? I see you. So it is a tool. There are several types of tools we can use to help us transition to and maintain a healthy weight. And there's not necessarily a right or a wrong tool. However, you want to use the right tool for you, and you want to be under the management of someone who is actually qualified and specialized in using that tool to help you assess what that best tool for you is. So what I mean by that is there are certain things that are tools using food, right? So I have a healthy weight loss nutrition program. I can do that or help people with that program from any state. And that is an amazing tool that helps people along their journey. Another tool is using weight loss medication. My medical license is in the state of Nevada. So for me to prescribe weight loss medications for my patient and to manage that aspect, you have to live in Nevada for me to be doing that for you. But you want to just find somebody actually qualified who knows what they're doing, physician that knows what they're doing when it comes to this, because it's a lot to know and a lot of ways to prescribe this medication correctly or incorrectly. Okay, so the first thing is this is a tool that can and does help people successfully transition to their weight loss goals and push past plateaus. Okay, so some people ask me, or a lot of people ask me, if I start weight loss medication, do I have to be on it forever? No, not necessarily. It can be a short-term tool for some people. It can be a long-term tool for some people. The main thing I like to help people understand is, there is so much stigma around weight. There's so much stigma around being obese or overweight. And I help to release that stigma, okay? When we look at blood pressure, when we look at diabetes, for some people, they need diabetes or blood pressure medication for a short period of time, for 6 to 12 months, for example. And there are some people who do need it lifetime. Same thing for weight loss medication, okay? People who struggle with weight typically struggle with weight chronically, but not everybody. Some people just struggled with it because they had babies or because something happened in their life that required for them to be more sedentary. And so again, all of this is personalized to the individual, but tip number 1 to know is that weight loss medication is a tool that can and does, when prescribed correctly, help people to transition to their weight loss goals, okay? Now, this leads me to tip number 2, okay? And this one, y'all, is the focus that I really want you to ingest, okay? Hello, everybody joining. Where are you guys joining from? All right, I saw South Carolina joining too. What's up? And so the other thing, tip number 2 that I want you guys to know is Healthy habits are key. Healthy habits are key. With anything, with any tool you use, whether you're using a food product to help you transition to a healthier weight, whether you're using medication to help you transition to a healthier weight, it is just part of the picture. The main foundation is the healthy habits, transitioning to those healthier habits. Here at Inspire Primary Care, the reason we are not a weight loss clinic, we are a primary care clinic that helps and assists our patients with weight loss using weight loss medication. Because of that, I tell everybody, if we start you on weight loss medication, the medication will get the weight off. The medication will not keep the weight off, okay? We have to be working on the habits while we're using medication as a tool, okay? What I mean by that is, in my practice, I schedule my patients for a separate visit called a wellness visit. At that visit, we use my Inspired Health method, which helps them to create a personalized wellness plan, and we follow up on that wellness plan monthly. We make small changes over a long period of time, which helps the weight loss to be sustainable. We're looking at nutrition, sleep, exercise, and movement. They're stressors, okay? All of these other aspects that can be contributing towards their weight loss, the parts that we can control through habits. We can't necessarily control the genetic component. We can't necessarily control some of the environmental components, but there are many components that we can make changes to over time to help us maintain and make this sustainable long term. Is it making sense? I'm seeing Maryland. I'm seeing New York. You guys are joining from all over tonight. That's what's up. Okay, if you guys have any questions along the way, drop that too, because this is a topic I'm very passionate about and I could just go. Okay, so those are the first two tips is that one, weight loss medication is a tool and it does work if it's used and correctly. But tip number two is that healthy habits are the key and the foundation. Okay. Tip number three, or the third thing that I want you guys to know is, okay, I like to say that there are lots of scams. So buyer beware is tip number three. The third thing to know is buyer beware. Of course, the weight loss industry is a huge industry, has always been a huge industry, will always be a huge industry. Over half of our population is overweight or obese, okay? And by 2030, very shortly, over half of our population, it's estimated that about 60% of our population will be obese. So this is a industry that will always be a huge money-making industry. And it's important for us to realize that not all methods that are promoted are going to be with the best intentions, or, some of it is about the dollar, okay? So buyer beware means that it's important to do your research. It's important to do your research from legitimate sources. It's important to look up the background in the person that is prescribing. Is this someone who is not a physician, who is not trained in this? Is this a weight loss clinic who is staffed by people who are not trained in this? Are they giving out vitamins and telling you that that's going to lead to 50 pounds of weight loss, which there is no evidence behind that? Are they promoting other non-evidence-based things like HCG shots? Are they using evidence-based medicine, FDA-approved medications for weight loss that have evidence behind it and prescribing it correctly? These things are prescribed by a physician for a reason. There is a lot that goes into it. It's important for the physician to know the physiology behind it, the mechanism of action behind the medications, the adverse effects of the medications. It's important for the physicians to be looking at your past medical history, your surgical medical history, your family medical history, your allergy profile, and making sure they are recommending the medication that is best for you. Okay? Are you getting what I'm saying here? It is not a one-size-fits-all thing. You got to go to somebody who knows what they're doing. Okay? I see a comment here that says, yes, menopause is stopping me from losing weight. So many of my patients that join the practice as weight loss members, they are either in a phase of life like menopause where they have really noticed difficulty losing weight in that season of life. And my weight loss program definitely works and has helped them push past the plateau and helped them to transition to their ideal weight where they feel they're healthiest. But again, it has to be by someone who knows what they're doing. Okay. So I recommend, if you are in the Las Vegas area, then that's a no-brainer for you. Shantae, the realtor, Inspire Primary Care is like the place for you. But if you're not in the Las Vegas area, then you want to do your research on the foundation of the people you would be looking into. Okay. Look for a physician that is specializing and actually qualified to do medical weight loss therapy. All right. So tip number 3, where are we at? Tip number 4. We're on tip number 4, y'all. All right. Tip number 4 is every medication is not for everybody. And I touched on this a little bit. All right. Again, we need to look at the full history, all of the adverse effects, all of the things I just rambled off. Okay. You have to, the doctor that is prescribing this has to be looking at the full picture to give a personalized recommendation. Also, the way that we titrate the medication for weight loss, it needs to be a monthly check-in to make sure that we are appropriately adjusting the medication and assessing any adverse effects or side effects that are happening. So again, just make sure it's being done by somebody who knows what they're doing. And if you're in Las Vegas, you already know Inspire Primary Care is where you need to be. It is my pleasure, Shantae, the realtor. Okay. And then tip number 5. The 5th thing that I want you guys to know when it comes to weight loss medications, there's so much we can cover on this, guys. If you have specific other questions I didn't cover tonight about weight loss medications, drop them in the chat. I'll watch the playback. I can always come back on and give you guys more on this. But tip number 5, or thing number 5 I want you guys to know is Inspire Primary Care is now enrolling new medical weight loss patients. Okay. So at our practice, we have 2 membership tiers. We have the primary care membership. All of our wellness consulting and wellness visits and personalized wellness plan is included in our primary care membership. However, we now have a medical weight loss membership tier because this has really become so popular, so successful. We have seen the most incredible health transformations at the practice. It has been a pure joy to experience with our patients, seeing them reverse by transitioning to a healthier weight, seeing them transition to their diabetes being reversed, their high blood pressure being reversed, their cholesterol being reversed, and us being able to safely transition them down and off of medications simply by transitioning to a healthier weight. Increased weight is tied to almost all of the chronic diseases. So this is why I am so passionate about helping people to transition to a healthier weight, because it helps to alleviate almost all of the other chronic disease burdens. Okay. So if you're in the Las Vegas area in the state of Nevada and you're looking for a place that will help you to transition to a healthier weight or maintain a healthier weight if you're already at your goals and you want a wellness focused primary care physician, I would love to care for you. We're now enrolling primary care and medical weight loss members at inspireprimarycare.com. What questions do you guys have? Drop them in the chat. I'll come back and answer them in the comments, and I'll see you guys next time. Bye.